You might or might not get to hear the word inflammation from your doctor a lot, but it is hyper crucial, important, and a lot of other adjectives to state its importance for the human body. But before I start fundamentally, both swelling and inflammation are different. Swelling can occur without inflammation, but the other is not possible, and we will talk about it sometime in the episode. Now, inflammation is one of the most important processes in the human body, often described as the body's natural response to injury, infection, or harmful stimuli. It is the immune system's way of defending us, eliminating threats, and initiating repair. However, while inflammation is essential for healing, it can become a double-edged sword, especially when it becomes chronic. I'm Dr. Akash Sehgal. You're listening to the Dr. WashBrains podcast, where we are making health a dinner table conversation. Today, we're talking about inflammation. Let's dive in. At its core, inflammation is the body's attempt to protect itself. Whenever tissue is damaged or exposed to harmful invaders like bacteria or viruses, the immune system activates an inflammatory response. This response involves the release of immune cells, blood vessels, and signaling molecules that work together to eliminate the cause of harm and promote healing. Think of inflammation as an alarm which is going off in the body. When it is a short term issue, the fire department of the body, the immune cells, they quickly arrive, deal with the problem, and leave. But if the alarm keeps going off in the form of chronic inflammation, the constant response can lead to damage over time, wearing out the body's tissues and organs. One of the most common signs of injury or infection that patients notice is swelling, often accompanied by pain or regular general discomfort. But people often confuse swelling with inflammation and assume that they are the same thing. While they are closely related, there are key differences between the two. Let's try to break it down a little. Now, inflammation is the body's natural response to injury, infection, or harmful stimuli like toxins. It's a complex biological process where the immune system activates various cells and chemicals to protect and heal the affected area. Think of inflammation as the body's internal alarm system, designed to eliminate the cause of injury, clear out the damaged cells, and initiate repair. Now, inflammation has four classic signs. In college, we used to read it as the four cardinal signs of inflammation. So, the signs are redness. Due to an increased blood flow, the whole area will appear to be red. Then we've got heat, that as a result of the body sending warm blood to the affected the area would be warm. Then we've got pain, which is caused by chemicals like prostaglandins, which irritate the nerve endings. And then we've got swelling due to a buildup of fluid in the tissues. So, apart from these four, we've got another one which we'll talk about sometime later in the episode. But remember that these signs are basic evidence that your immune system is hard at work. Inflammation can be localized. Localized meaning affecting a specific area like a cut or an infected joint, or systemic, where it is affecting the entire body, such as an autoimmune disease. Swelling, on the other hand, refers specifically to the enlargement of tissues due to the accumulation of fluid. It is often a visible outcome of inflammation but can occur independently as well. Swelling happens when blood vessels in the affected area leak fluid into surrounding tissues, causing them to puff up. Unlike inflammation, swelling does not necessarily involve the immune system or chemical responses. Swelling can result from other causes such as injury, for example, a sprained knee or an ankle, fluid retention, for example, conditions like heart failure, allergies like pollen, pregnancy, hormonal changes can cause fluid retention. So the key point here is that swelling is a symptom, whereas inflammation is a process. So whenever some people wake up, they generally wake up with puffy cheeks, puffy eyes, and that is swelling. The most commonly visible example of swelling is puffy eyes, even after when you have a good cathartic cry. Moving on to how are they both similar? Swelling is often a part of the inflammatory response. When your body senses injury or infection, blood vessels in the affected area become more permeable, allowing immune cells, nutrients, and fluids to flood the area. This fluid buildup causes swelling, which is why it is often linked with inflammation. Both swelling and inflammation serve as signals from your body that something is wrong, urging you to address the underlying issue. They do share some common characteristics. Like both are responses of the body to injury or infection. Both of them serve as protective mechanisms. And both can cause discomfort. Whenever there is swelling or inflammation present, there can be pain. There can be an inability to move a particular joint. But now talking about how are they different? Now, while inflammation is a broader immune response involving many cellular and molecular mechanisms, swelling is simply one component of this process. Now, more distinctly, can you have one without the other? Yes, it is absolutely possible to have inflammation without noticeable swelling, especially in deeper tissues or organs. For example, inflammation in the lungs due to conditions like asthma or pneumonia may not cause any visible swelling, but can still severely impact lung function. Conversely, swelling can occur without inflammation, such as when your legs swell from sitting or standing for long periods of time due to fluid retention rather than an inflammatory response. Now, treating inflammation and swelling often go hand in hand, but specific approaches may vary depending on the underlying cause. For inflammation, we've got NSAIDs, non-steroidal anti-inflammatory drugs, which include your ibuprofens and your aspirins, or corticosteroids, and they're often used to reduce the body's immune response. Lifestyle changes such as eating an anti-inflammatory diet and reducing stress can also help manage chronic inflammation. And for swelling, the classic convention used to be rice, rest, ice, compression, and elevation. But recent researches and also confession from the guy who quoted the term rice is now defunct. You will have to apply heat to the particular area. So, rest, heat, compression, and elevation commonly recommended to reduce swelling, especially in injuries. Diuretics may be prescribed in cases where fluid retention is causing the swelling, for example, in your heart or a kidney disease. Now, understanding whether your symptoms stem from swelling or inflammation or both can help guide the best treatment. Always consult with a healthcare provider if you are unsure, especially if the swelling is severe or accompanied by other concerning symptoms. Together, inflammation and swelling help protect you. But when they linger or become chronic, it is time to take action. But before we begin, we need to talk about why we need to know about inflammation. It is crucial, it is very crucial to know about inflammation because it plays a dual role in our health, both as a protector and a potential cause of long term damage. Now, inflammation, a natural defense mechanism of the human body, as it is the response of the human body to injury or infection. It is part of the healing process, signaling the immune system to fight off harmful invaders and repair tissues. By understanding this, you recognize the role inflammation plays in recovery and can better appreciate its short-term benefits. Now, while short term inflammation is necessary, chronic inflammation can be harmful. If your immune system stays in fight mode for too long, it can damage healthy tissues and organs. Chronic inflammation is linked to serious conditions like heart disease, diabetes, arthritis, and even cancer. Knowing about inflammation can help you prevent these diseases or manage them early on. Now, recognizing the symptoms of inflammation, redness, swelling, heat, pain, this can help you spot health problems early. For instance, ongoing joint pain may signal arthritis, while persistent inflammation in the gut can indicate conditions like Crohn's disease. Early detection and management of inflammation can prevent the progression of many illnesses. Now, inflammation doesn't just cause disease, it can also affect how you feel day to day. Fatigue, body aches, and mood changes can all result from underlying inflammation even before a major disease develops. Understanding this connection allows you to make lifestyle adjustments such as dietary changes or stress management to keep your inflammation in check. Now, by understanding inflammation, you can make informed choices about managing it, whether through medications like NSAIDs or natural remedies such as anti inflammatory diets. Understanding the role inflammation plays in your body helps you find the best strategies for reducing unnecessary inflammation and improving your overall health. So, in summary, knowing about inflammation is key to understanding how your body responds to harm and how prolonged inflammation can lead to chronic diseases. It also helps you take proactive steps to manage your health, reduce risks, and maintain your well being.